Hi class, welcome to week 5 of Law and Ethics. We are going to be talking about different dynamics with relationships. This is super important because many of you may want to work as a clinician in your community. That could look like your church community, that could look like just your community where you live. And there's nothing that feels more, I want to say isolating. I don't know if that's necessarily the right word, but it can feel very isolating when you work in a community and you see a lot of people in the community, and then you're realizing now I have to have a different dynamic of relationship with the people that I associate with. It can make your world feel very small. And so we're going to talk about this. It's important for you to really think about this. There's that really kind of crass little phrase where it's like you don't eat where you poop, which is for a lot of reasons, right? One, because it's gross. Two, because of sanitary reasons, health reasons. And you may be someone who decides to practice maybe in the city right next to your city, so maybe there's not as much crossover between people, children, with your kids' school district, just run-ins. But the world is small and we run into people in very miscellaneous random places. So anyhow, we're going to be talking about that this week. So multiple relationships. So there's legal issues, and then of course there's ethical issues. When you have multiple relationships with someone, it could impair judgment, right? You may not be able to give them the best service that you could if you were completely objective, and it could cause exploitation of clients, right? It might be a way to take advantage of someone. There is different ways to view it. Some people focus on the inherent problem in multiple relationships. Others view them as common, inevitable, unavoidable, normal, and healthy, part of communal life in many settings. So that's what makes something ethical, right? It's not just straightforward, black and white. Each circumstance can look a little different. For myself, when people, like, a lot of times people will say like, oh, I'm a therapist, and they'll be like, oh, can you see me? And I'm like, no, because you're my son's friend's mom. Like, I don't, it, like, maybe for that person that feels like that would be very comfortable because they know me, they feel comfortable talking to me. But for me, it's uncomfortable because now my dynamic with them has to change. So I don't want to have to change the way I operate because they want to see me as a therapist, if that makes sense. And so people oftentimes don't understand what the therapeutic relationship is, not because they're stupid or something, but just because they don't have the experience or they don't understand the dynamic. I think when people truly do understand, they wouldn't necessarily ask those questions because they're like, oh, I know, I really don't want my therapist to know me at all or be familiar with me at all. Now, I'll tell people all the time, like, look, like, I can't see you, but I can refer you to somebody great, somebody at my office, somebody I trust. Like, I think you would really like them. That's totally different, and that feels safe and that feels fine. And even though people are seen at my office, it's not like I know about what they're talking about. So there's still that confidentiality, right? They can talk about whatever they want to talk about, things of that nature. And it remains in-house, for us professionally. But I don't have to operate any differently just because they're being seen at my office. So before entering into a multiple relationship situation, meaning like your client outside of a client, you would have to examine your motivation. Does it make sense for the treatment plan? Client's history, culture, values, diagnosis. Is the relationship documented in the client's record? Was it discussed in advance? Is the client's trust safeguarded? Have you consulted anybody else about it? Like, are you really sure that this is a good idea? There's a difference between a boundary crossing versus a boundary violation. So a boundary crossing is a departure from commonly accepted practices that could pointedly benefit clients. So, like, for example, like attending a student's school play or sports event to build a positive relationship with him or her. I have gone to support clients' things before in the past. A boundary violation could be a gradual erosion of the boundary that leads to maybe a sexual relationship with the client, which is, no bueno, no good. And that's very unethical. Okay. You can't have your client be also your boyfriend or something. Minimizing risk in multiple relationships. So set healthy boundaries. I actually was at an event last night of a close family friend. And of course they wanted to see me for therapy. And I said no. But I said, I'll refer you to someone great. Like, or I said, I would have, because obviously I shouldn't say obviously like in a narcissistic way, but like I have skills in conflict resolution and things of that nature because of our job, right? So I said, I would meet with you to talk through what you're experiencing as a person you know that has these skills, not as a therapist, because I wouldn't accept money from you, 1. 2, I know you would have a really hard time doing that with me without paying me. So I think it just would be best that you see somebody else, which they did. But it was so funny because they wanted to invite the therapist to the event I was at, and they had to remind them, the therapist, remember, I'm not going to necessarily acknowledge you in public, or went over the boundaries against them. And again, it's like people, they're like, but you'll get to see all the players in the game. Like, come to this event and you'll get to see about the family stuff we're talking about, which is maybe very true. However, not how it works, right? Not how it works. So set healthy boundaries with clients, secure informed consent, which is really important for anyone who comes to therapy, consult with other professionals, seek supervision when needed, which that's what all of you will have initially, document. Remember checking your own heart motivations, and refer out when necessary. And there's nothing wrong with referring out, like this isn't one of those unethical reasons for referring out. These are the kinds of things you should be referring out for. Okay. So again, like there's a lot of different thoughts on this. Some of you could end up working in a very rural community, which makes it a little harder. So, you might have to blend several different roles together just out of the fact that there's not anyone else around. Now to me, this is very specific and for very specific kinds of communities with not a lot of people. But this would not be the common occurrence of anyone in a major city, anywhere urban. We're not going to have some rural dynamic, because we won't have the same person isn't the teacher as they are the grocery store. You know what I mean? Like, whereas in rural areas, you might have people that play many different parts. And so someone might come into counseling and could also be your child's teacher, or could also be your doctor. I mean, potentially, I don't know. So that's where it's like, these are the ethical questions to ask. Like, is this reasonable? Is this right? Because it could come up in these certain circumstances. Okay. Bartering for professional services, again, rural community, evaluate if it puts you at risk, determine the value of goods over services. So like, is what they're bartering with you with worth the same as what you were giving? How long is that arrangement, and document arrangement. Like, so if someone like had no money and they're like, I'm going to give you chickens or eggs for your services. So how many dozen eggs do I need to get that equates to what my services are? Again, this wouldn't work in every circumstance. I think it's very specific when we're talking about rural communities, somewhere very specific, but that would not be every situation by any means. I don't think so. I've never come across that. I'd rather just get paid. But again, depends on where you're working. It might be something that you would have to do, and there is rules and ethical guidelines for that. So giving and receiving gifts. What's the monetary value of the gift? Was it appropriate in the sense of, was there clinical implications in accepting or rejecting the gift? Like, could this be very offensive for culture? Things to take in consideration. Some cultures that's really important. What are the motivations? Why is the client gifting you something? Now, I have been a clinician, like I mentioned, for a long time. In that time, I had all my kids. So I was pregnant 10 years of my career. And of course, my clients all saw me pregnant, and of course, they all wanted to get me a onesie or something. okay, is that wrong? Well, this is where it's ethical. Like, is this appropriate or not appropriate? I mean, they're trying to be generous. They're trying to be nice. Now, did anyone give me anything outlandish or like a cash value that's like cash straight off? No, not at all. Anyone who decided to get me anything, it was very appropriate for the sake of me being pregnant. They knew a baby was coming, or they knew I was going on maternity leave soon. So they wanted to do a little something for the baby. Totally appropriate. Totally would have been really rude if I had rejected it. Nothing that was outlandish as far as monetary reasons. It was for an obvious season. So again, no implications. Now, if someone started giving outlandish gifts that were like thousands of dollars, or wanted to give you something and then ask for something that seemed like it was tied to the gift, or someone's trying to like make a pass or hit on you and is giving you things that seem very inappropriate, may want to second guess like what's going on here and not accept something. You really just have to be mindful of like what these people's intentions are, depending on who's giving you gifts. I have had clients, it's very cultural to give a gift, especially when our time was coming to an end. I think it was like premarital counseling, so it was like a definitive time it was ending. And so again, like they gave me a card. I wasn't anticipating a gift card being in it, but a gift card was in it. But again, very culturally acceptable, and made sense. So just again, be mindful of that, because it could be really rude to not accept it. I have a client who makes me artwork. I'm not going to not accept it. But again, there could be people who are doing things to try to see what boundaries they can cross, and you really got to make that clear. Now, you may work at a facility that might make it very clear, like anything over $20 we're not accepting, or might make it clear never accept anything from any, person. And if maybe they make it a blanket statement like that, then it'll make it easier to be like, you know what, I really appreciate the gesture, but I'm not allowed to accept this professionally due to my site. So thank you, but no thank you. That makes it easier to just like be like, no. But some of you aren't going to work at places like that or have those rules. So just, you have to really be conscientious of what you're doing. Social relationships with clients. So, some therapists may not challenge clients they know socially because of a need to be liked and accepted. But counselors' own needs may be enmeshed with those of their clients to the point that objectivity is lost if you have a social relationship with them. You could risk exploiting your client in some sort of way. Your client needs you more as a therapist than as a friend. I've been in situations like this where it's like I saw someone, our circles somehow ended up intermingling, and then I thought about it, like maybe I should just say I'll meet this person for coffee and they don't need me as a client. Like I could just be their friend and not a therapist. And I had a friend tell me, she's like, Tony, I think she needs you more as a therapist, because she called back to come back in. It had been some time. I think she needs you more as a therapist than she needs you as a friend. And that's like maybe to make things a little bit more comfortable for you. This isn't what you're thinking about isn't for her. And so I thought through that and I agreed. And so it remained that way, a therapist client relationship, and which is totally fine. But it did remain that way. So sexual attraction in therapy, it can happen. Attraction to clients is a prevalent experience of both male and female therapists. Simply experiencing sexual attraction to a client without acting on it makes the majority of therapists feel guilty and anxious and confused. Obviously, if you have a partner, that could add some of the guilt. I think also too, like knowing your role that you have with that person and then finding them just attractive could be distracting. And so this could create an issue while trying to treat them, or it could cloud judgment or things of that nature. There's a difference, however, between finding a client sexually attractive and being preoccupied with the attraction. So where you're obsessed with it and keep talking about it and can't get out of it, that's a very different experience. So if it's costing you those kinds of things, then you really need to figure out what you're doing. Maybe shouldn't be seeing that person. So to minimize the likelihood of sexual transgressions, learn to recognize sexual attraction and how to deal with these feelings constructively and therapeutically. Seek professional support during times of loss or crisis. Examine and monitor feelings and behaviors towards clients continually. Know the difference between having sexual attraction to clients and acting on this attraction. There is a difference, right? Learn about the possible adverse consequences for clients and therapists who engage in sexual activity, and establish and maintain clear boundaries when a client makes a sexual advance towards you. Okay. So if the sexual feelings are getting in the way of therapy, you shouldn't be their therapist anymore. Recognizing that direct, explicit exposure of sexual feelings can run the risk of harming clients and may therefore be unethical. So again, keeping yourself in check. And rather than making any explicit communication of sexual feelings for clients, acknowledge caring and warmth within the therapeutic relationship, making sure, again, what are you doing here? Like, this is like danger, like, be very careful. This is something that could cause you to lose your license, cause your supervisor to lose their license. Like, acknowledge sexual attraction. Absolutely. What do I need to do? It might be something you can work through. It might be something that you can't, but be very careful with how you proceed. Proceed with much caution and much advice and consultation, because you don't want to do something that's wrong. You want to make sure you're talking to your own therapist, your supervisor, potentially other colleagues to see, like, how do I proceed in this situation? I'm sure you wouldn't be the first person to be attracted to the client or a last, but how we handle that can cause you to be in the back of the camp magazine, which none of us want to be, okay? Which is where everyone who gets in trouble is, okay? So you don't want that for yourself or for anyone else that you know. Okay, so clients who are victims of sexual misconduct suffer dire consequences. There could be a distrust of a therapist permanently. There could be PTSD symptoms, guilt, depression, anger, feelings of rejection, cause of low self-worth, and suicidal ideation. So legal sanctions against sexual violators. So being a target of a lawsuit, being convicted of a felony, being expelled from the professional organizations. You guys are all working so very hard to get licensed. You don't want to lose your license over something of this nature. Obviously, you could lose your job. So there's a lot of things that you're putting on the line if you're attracted to somebody and act on it inappropriately. So most professional organizations prohibit such relationships even after a 2 to 5 year interval. The burden of demonstrating that there has been no exploitation clearly rests with the therapist. So there are guidelines. I believe it's, I think it's 7 years where you have, and then you could potentially date somebody, but it's a good chunk of time. Is it worth it? I don't know. I don't think so. Is it worth putting your license on the line that you've worked so very hard for? Absolutely not. Is it worth putting your supervisor's license on the line? Absolutely not. As a fellow supervisor, no, do not put your supervisor's license on the line for something that you intentionally know that you're doing that is not okay. So we're switching gears a little bit, talking about how you are trained. So as you're getting trained to be a therapist, there is an ethical responsibility to make sure that we are clear in what we are teaching you, knowing what the limitations are with what we are giving you. We have to combine academic and personal learning. We're teaching a wide range of skills, and obviously we are teaching you ethics, right? A core ethical and professional issue involves formulating policies and procedures for selecting appropriate candidates for a training program. And so, we have to screen, you guys were all interviewed, I believe, to get into the program, to make sure you are the right fit, to make sure that this is a good situation for you. So there is a screening that's involved to make sure, again, this job isn't meant for everyone. Just like how police officers are given a heavy duty background check. I know when I joined the MFT program back when I was a student, I had to do an MMPI. We did the Myers-Briggs. We had to meet with the director of the program. I don't think it's as intense as all that, but there's a level of, is this a right fit for you? Do you feel like you're representing the university when you go out there in the world and you start practicing. So we want to make sure it's a good representation, all the things of that nature. And so we have to look into that to see, you know, and 3,000 hours is a lot of hours. So some of that might be the weeding out process of maybe people who were in the program, maybe shouldn't have been in the program, or just really aren't a good fit. So the hours can do that. But overall, it is something that the university tries to be mindful of. The academic faculty in a professional program generally has a gatekeeper role. So they're protecting, trying to make sure everyone's ethical, doing what's right, accomplishing the tasks at hand, and represent the university well. Peers can play a role in this in helping identify students who may need a remediation or dismissal based on maybe behavior they're experiencing or something of that nature. I think a lot of days now with social media, you know, we can put a lot out there that may not be good, but you know, people are seeing it, and so to be mindful of that. That you could have other professional people are seeing this, your professors could be seeing this. So what you're putting out into the universe, you might need to be mindful of what that is. Just so you're protecting yourself and how you're representing yourself. Okay. And then of course there is a professional licensing certification that you have to go through. You know, you're going to be becoming trainees while it's still in the program, then associates, and then hopefully you'll be on your road to licensure. There are things you must do to accomplish that. You need to make sure you know those things. You're having the proper documents signed off, all those kinds of things, so you can get to the licensure status. There will be a test that you take that you have to pass for the state of California to grant you your license. Okay. Well, I hope you guys have just had a wonderful week and are able to get all this information and soak it in, because it is so important. I will be in touch next week. If you need anything, please reach out, send me an email. Thank you.